Good morning. I'm Kevin Lofton, CEO of Common Spirit Health. While I can't be with you all today, I want to thank you for all the work you do as employees, board members, volunteers, and community partners in the ministry of CHI St. Joseph Children's Health. During the next 2 days, you'll have the opportunity to engage with leading experts and scholars working on the key issue of poverty in our communities. We hope you'll increase your understanding and expand the dialogue on what is possible. I wish I could be there with you, but I'm attending our Common Spirit Health board meetings. As you well know, service to those who are poor and vulnerable has been at the heart of our ministry. It's been there since the founding of our first hospitals more than 150 years ago by various congregations of women religious, including the Sisters of St. Francis of Philadelphia, who formed your ministry at St. Joseph Hospital in the 1880s. Their goal, and now ours, was to end the pain and suffering of others. Many times, that pain and suffering are the result of poverty. This is why our work today and our commitment to those who are poor and most vulnerable in our communities has never wavered. Today, as we begin the latest chapter in our journey to create healthier communities across the United States, this commitment is still at the core of our new organization, just as it was throughout our history, first as independent hospitals and regional hospital systems, then as Catholic Health Initiatives and Dignity Health, and now as Common Spirit Health. When we were developing our name, Common Spirit Health, we were inspired by this scripture verse from 1 Corinthians. There are different kinds of gifts, but the same Spirit distributes them. There are different kinds of service, but the same Lord. There are different kinds of working, but in all of them and in everyone, it is the same God at work. Now, to each one, the manifestation of the Spirit is given for the common good. The idea of the common good is central to our approach to healthcare and serving our communities. We truly believe the common good needs and deserves a champion. That is the role Common Spirit Health has been called to play in our communities and across the United States. Serving those who are poor and vulnerable is about recognizing the social determinants of health that impact people's lives. Serving those who are poor and vulnerable is about walking along with them on their journey. It's about understanding their needs and their challenges. It's about celebrating their victories and assisting them when they are challenged. Serving those who are poor and vulnerable doesn't start at the doors of our hospitals or our clinics or our behavioral health centers. And it doesn't stop when they leave our facilities either. No, serving those who are poor and vulnerable is about being one with them, walking with them on their path as a friend and a trusted companion. That's what it means to fulfill our calling, just as you have done in Lancaster to create innovative approaches to meet the needs of your community. That's what it means to be a champion for the common good. Over the next few days, this conference will allow you to grapple with the issue of poverty, what it is, how it impacts us as individuals and as a community. You'll also explore how to overcome the barriers and challenges poverty creates. These are not easy discussions, nor are they easy challenges. I encourage you to let yourself wrestle with the issues, to ask questions, to probe deeper in your pursuit of understanding, and in our desire to be of service. Together, we can truly transform healthcare and create healthier communities. This work begins with grassroots efforts such as the work you've done here. Thank you for all you do for the Lancaster community, for CHI St. Joseph Children's Health, and for Common Spirit Health. God bless you all.